How to read a medical bill. Common hidden fees you can challenge. Is your medical bill just another scam? Now I know what you're thinking. That's a bit dramatic, right? Maybe not. One of the most frustrating aspects of healthcare in the US is deciphering a medical bill, which, as many have discovered, can be riddled with hidden fees. That's why today, I'm here to walk you through the process of understanding what's on your medical bill and how to catch those sneaky, unexpected charges. You might be surprised at how much you can save by simply being informed. In this video, we'll dig into how to decode your medical bill line by line, the most common hidden fees you should look for and challenge, anecdotes from real people who've managed to reduce their bills, actionable steps to dispute erroneous charges. Don't worry though, you won't have to do it alone. I'm here to guide you through it all. And of course, if this kind of information sounds useful, don't forget to subscribe to US Healthcare Explained so you can keep up with future content that'll help you survive and thrive in the US healthcare system. Why medical bills are so confusing? Let's be honest, getting a medical bill in the mail can feel like you're reading another language. Why? Because medical bills are designed to be hard to understand. This may not be deliberate, but the outcome is that millions of Americans end up overpaying simply because they don't know what they're being charged for. Case in point, a forum user shared that they were billed $50 for a brief emotional counseling session that never actually happened. They had only spoken to a nurse while waiting for the doctor, and apparently that 5-minute chat counted as a separate service. I had a good chuckle when I read that, but also, what an outrageous charge, right? Breaking down your bill. Here's where you need to get your detective hat on. 1. Understand the layout of a bill. Your medical bill typically has the following sections. Service date is when you received the care. Description of services are what treatments, tests, or procedures were done. CPT codes, these are procedural codes, crucial for understanding what you're paying for. Charges are the initial cost before insurance. Insurance adjustments are the discounts negotiated by your insurer. Amount due is what you owe after insurance kicks in. Pro tip: pay close attention to those CPT codes. They might look like random strings of numbers, but they hold the key to deciphering whether the charge is legitimate. Sometimes hospitals accidentally or conveniently list more expensive services than what you actually received. Cross-referencing the codes with the procedures can reveal overcharges. Common hidden fees that you can challenge. Now for the juicy part. Here are the most common hidden fees experts say to watch for on your medical bill. 1. Facility fees. Ever notice a line that says facility fee or service charge? It's often hundreds, if not thousands of dollars for simply walking into a hospital or clinic. This fee can be contested if you had a minor procedure or were simply visiting for a consultation. I once read about a woman on a forum who was charged a $1,200 facility fee for a 30-minute outpatient procedure. After calling and challenging the charge, she had it reduced by 75%. So yes, challenging is worth it. 2. Double billing. This one gets people all the time. It happens when you're charged twice for the same procedure. The sneaky part is that it might not look exactly the same on your bill. It could be phrased differently, like being charged for lab work and diagnostic services when both are actually the same test. 3. Out-of-network providers. Sometimes you'll get a bill that says you saw an out-of-network provider, often when you had no idea this was the case. This can happen even during emergency visits. However, it's your right to challenge these charges, especially in emergency scenarios. A man I came across in a healthcare forum shared that he was billed over $2,000 for an anesthesiologist who was out of network, even though his surgery was at an in-network hospital. He called his insurance, disputed the charge, and had it knocked down to $300. That's nearly $2,000 in savings. 4. Miscellaneous fees. If you see a miscellaneous fee, immediately flag it. That's often a catch-all term for charges that are either inflated or unnecessary. You have every right to ask what exactly is included in that vague term, and challenge anything that looks suspicious. 5. Itemized bill padding. Always, and I mean always, request an itemized bill. Hospitals can sometimes pad non-itemized bills with extra costs like gauze, gloves, or even electricity use. These aren't always huge charges, but when you add them up, they can turn into significant amounts. How to challenge hidden fees. Alright, so you've spotted something fishy. Now what? Here's your action plan for tackling those hidden fees. 1. Ask for an itemized bill. This is your first line of defense. Hospitals often send vague, non-itemized bills to mask overcharges. Request a detailed breakdown of every service and fee. 2. Review CPT codes. Use a site like FairHealth Consumer to look up CPT codes and make sure you're being charged fairly. 3. Contact your insurance provider. Sometimes your insurance can help with disputes. They may have agreements in place that prevent certain overcharges. 4. Call the billing department. Get ready for some back and forth, but stay persistent. Billing departments can and will negotiate if you push. Keep your itemized bill and insurance policy on hand when you call. 5. File a formal appeal. If the billing department isn't cooperating, escalate the issue by filing a formal appeal with your insurer or hospital. You can also get help from consumer protection groups like the Patient Advocate Foundation. One of my favourite stories is from a forum where someone shared how they fought off a $500 charge for operating room supplies. They argued that such supplies should already be included in the base surgical fee, and guess what? The hospital agreed and dropped the charge entirely. Another time, I read about a guy who spotted a $200 charge for a glucose test he never requested. When he called to ask about it, the hospital admitted it was added just in case the doctor ordered it. He had the charge removed with a single phone call. If you're feeling overwhelmed, don't worry, I've got your back. Let's quickly review the main points we covered today. Understand the layout of your bill. Know your CPT codes, service dates, and descriptions. Look out for hidden fees. Facility fees, double billing, out-of-network charges, and miscellaneous fees are the usual suspects. Always request an itemized bill. It's your right to know what you're paying for. Challenge questionable charges. Use the steps above to dispute anything that looks off. And if you're thinking this sounds like a lot of work, well, it can be. But taking the time to challenge erroneous medical bills could save you hundreds or even thousands of dollars. If you found this guide helpful, be sure to hit that subscribe button on US Healthcare Explained so you don't miss out on more tips and strategies to navigate the wild world of US healthcare. Also, feel free to drop your own stories in the comments below. How have you successfully challenged hidden fees on your medical bills? Until next time, stay informed, stay persistent, and don't let those hidden fees get you down. Don't forget to subscribe. Your wallet will thank you later.